Recently I sat down and thought about our quality assurance program, and I was reminded of one that my father had when he was an engineer at Boeing. I remember he came home from the office and he had a lapel pin and it said ZD on it, and I asked him what ZD stood for, and he said, well, Boeing's implemented he was a Boeing engineer, he said Boeing has implemented a quality control program called Zero Defects, and that's always stuck with me. I mean, the goal of having no mistakes, having everything perfect. And so we've instituted in our practice what we call ZD LASIK, and it stands for our commitment to try and reduce any problems, any defects to zero. We can't guarantee that everyone's going to have an absolutely perfect result. No surgeon can guarantee that. But we can tell you about our commitment to trying to get to that point and the progress that we've made over the years in doing that. So ZD, Zero Defects, is an important part of our ZD LASIK program. Cost is a problem for a lot of patients. This surgery, if it's done right, is one that involves a certain amount of cost. The equipment is over $500,000 to purchase, and it's expensive to maintain. So there is a cost to the surgery, but we try to make this affordable for people by offering payment plans, including some of which are zero down. So there's ZD for zero down. One of the fears that people have in having this surgery is they wonder if they're going to cause a problem by moving or having their eyes move while they're having the laser treatment. So in order to perform safer LASIK, we've added an eye tracker to our laser. It's a device that can see if the eye is looking straight up, and if the eye moves a little bit during it, it can move a little bit to keep the laser centered over the patient's eye. And if the patient's eye moves too much, the laser simply shuts off. So that's a safety factor, and we call that ZD, zero displacement. You can't move your eye and hurt yourself during the laser procedure, and that's something that a lot of patients feel much more comfortable knowing is there as a safety mechanism for them. One of the other things that patients are concerned about is whether the surgery is going to hurt. And we look to have zero discomfort with our LASIK. We give people relaxation medicine beforehand. We find that our efforts in educating patients about what to expect as they go through the procedure is really of great importance in terms of alleviating their fears and concerns, because they know what's going to happen to them. And of course we use a liberal amount of anesthetic agents in order to be able to perform the surgery, which is painless and which will heal up in most cases very, very quickly.